Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us once again. Going to have a conversation with Dr. Xiaoli Lin, MD, PhD, Executive Vice President, Head of Research and Development, and Chief Scientific Officer at Horizon Therapeutics. Joining us on the program to talk about some new data presented at the Annual European Congress of Rheumatology 2019, or EULAR 2019, that seemed to point to a systemic implication of uncontrolled gout and the need for treatment improvement. Welcome to the program, Doctor.
Thank you so much, Neil. Great to be here.
Now, I did give a little bit of background as Chief of Research and Development at Horizon. What is exactly your role there at Horizon?
Well, thanks for asking. I joined Horizon, as you mentioned, as Executive Vice President, Head of Research and Development, and the Chief Scientific Officer just about a year and a half ago. And as Horizon, we're actively in the midst of a very intentional evolution, actually, as a company that was originally founded by commercial expertise and execution to one that is research-focused with real intent to build a pipeline and portfolio of potential new medicines that can meaningfully impact patients' lives. And this is reflected in the fact that I am actually Horizon's first Chief Scientific Officer and Head of Research and Development, and also in our very recent name change from Horizon Pharma to Horizon Therapeutics, really to reflect that new intentional focus on therapeutics and building out a portfolio for potential new medicines.
We're talking about some data that's been presented at the EULAR about gout. Very briefly for our listeners who are mostly healthcare providers themselves, what is gout briefly and who's affected?
Yeah, so gout is a metabolic disease where people who are affected, and it's over 9 million people in the U.S. alone who are affected with this, ultimately either overproduce something called uric acid or undersecrete it, meaning they either make a lot of it in their bodies or they don't effectively get rid of it well enough. And at Horizon, we treat, and so the manifestations of gout are often thought of as very painful, swollen joints. You'll see, sort of very old pictures in history books about people with big swollen toes that are horribly red and painful. And this is the classic understanding and thinking about gout. People have approached gout therapies with things like diet, and that is effective for some. There are some oral medicines like allopurinol that are effective for many, but then there's still some patients out there, and these are the ones that Horizon treats and that we think about a lot, that have uncontrolled gout. And it's really within the context of these uncontrolled gout patients where we are seeing also, as you mentioned, and we shared at the recent European League Against Rheumatism meeting, the EULAR meeting, that uncontrolled gout can actually lead to terrible systemic manifestations that are associated with certainly morbidity, things like heart and kidney disease, as well as potential even for death.
Now, even though gout's a disease that's been pretty well documented for quite a while, this new data that was presented at EULAR, how is it shifting the thinking and the understanding of gout?
Yeah, so, we've really been seeing increasingly robust evidence that connects this elevated serum uric acid, which is the fundamental finding, metabolic finding within gout, to things like high blood pressure, linking gout and chronic kidney disease. Research also shows that the bone and joint damage that can occur even in patients with uric acid deposits or that are called tophi that aren't acutely inflamed. So you don't actually have to have that big, painful, swollen joint to have some of the damage that continues to be ongoing, and that the presence of detectable tophi or these uric acid deposits on physical exam can even be associated with almost a threefold increase of death. And that's why we feel an urgency to change the conversation around gout to help eliminate the consequences of, poor management or undermanagement and the impact of this chronic systemic nature of a condition to better ensure, sort of improved outcomes for patients.
So what do clinicians need to better recognize when it comes to gout and some of these systemic implications as you mentioned?
Yeah, I think the real takeaway is that gout isn't just a disease of the joints, as we might have thought for, sort of many, many years, that the data that is emerging, if we look at uncontrolled versus controlled gout, is that there's an increased incidence of real systemic disease that leads to things like increased chronic kidney disease, increased hospitalizations for congestive heart failure, increased hospitalizations for acute kidney failure, and that our work that's ongoing represents really a growing dialogue that calls for a more focused approach to managing gout, including improved monitoring efforts that can inform the use of novel therapeutic solutions to better manage the disease.
So beyond these rheumatic diseases, what other areas is Horizon researching as far as more systemic implications or the lack thereof?
Yeah, so we're interested in really becoming more of a research-focused company. We actually have recently shared data from a phase 3 program that looks at a potential new drug for the treatment of thyroid eye disease. It's a rare condition that is autoimmune in nature and really has a terrible impact on daily activities of daily living, and can even lead to blindness. And so that drug called teprotumumab will be filed. We've shared phase 3 data, which was incredibly encouraging. We think that it has the potential to become the first approved therapy for thyroid eye disease, but we'll know in the near future. It'll be filed sometime mid this year to the FDA for potential approval for that disease state.
Is it going to be effective in hypo and hyperthyroidism?
Great question. The thyroid eye disease, the eye aspects of it are typically associated with hyperthyroidism. But interestingly, you don't have to have your thyroid. The thyroid aspect of your disease actually can be either, it can predate it, it can be well controlled, and you can still have the eye manifestation. So it seems to be a bit of a separate disease state, if you will, relative to the thyroid aspect, although associated with hyperthyroidism. So typically associated with Graves' disease.
If our listeners would like to get more information about Horizon, about what's going on there, your research and development, and also more about EULAR and gout, what website would we be able to go to and get some more information?
So I think just the corporate website at horizontherapeutics.com should be informative.
Well, I thank you for joining us here on the program this morning. It's been a pleasure talking with you, quite informative, and I'm hoping that we can talk with you again in the future.
Thank you, Neil.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, download at SoundCloud, and be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.